patient education program. The patient story retains full editorial control over the entire discussion. And a quick reminder, this is not meant to be a substitute for medical advice. So this is really for educational purposes only. And the last thing we'd like to say is we really are very interested in knowing how to help you better. And so following this discussion, when you exit, you'll see a survey. And we just really want to ask how you, what you took away from the program, what you'd like for us to cover next time. And once you submit that into a raffle for one of our $50 Amazon gift cards. Okay, so done with the housekeeping, on to the program today. And I'd love to introduce our amazing hosts tonight, Michele Nadeem-Baker and Jeff Folloder, who are, of course, pretty familiar faces, I would say, who lead the largest Facebook support group for CLL, and would love to introduce themselves right now. So Michele, maybe you can kick us off tonight.
Thank you so much, Stephanie, and thank you for ensuring that the CLL and SLL communities are spoken to here at the Patient Story. I am Michele Nadeem-Baker. I am a medical and health journalist, but I am also a CLL patient. And when I was first diagnosed back in, my goodness, 11 years ago in 2012, things were so much different in the CLL landscape. But I had made a vow once I started treatment to try to help other patients. And ever since then, I've been growing my patient advocacy and patient leadership. And one of the people I do that with is Jeff.
Hi, my name is Jeff Folloder. I am a passionate patient advocate. I really take this seriously because it's really, really important for me to share that you can live a great life with CLL. Not just a good life, a great life. And it occurs to me as I'm getting ready for an appointment next week, I just entered my 14th year of dealing with CLL, and it seems like yesterday I got the diagnosis. But what I'm really excited about right now is introducing you to Lisa. Lisa is someone that I met years ago in a waiting room for CLL. And I'm so glad that she's going to share her story. Lisa, tell us just a little bit about yourself.
Thank you so much. So I also was diagnosed in 2012 and can't believe it's been almost 11 years. So it, just went for a routine physical and got the diagnosis. So came as a complete shock. And then my journey began. It doesn't define who I am. I'm a mom of 3 grown children. I'm a yoga instructor. I actually came to yoga after my diagnosis to help with dealing with it. Became a mental practice that was helping me to not spin the stories into the scary direction, but stay grounded and focused on what was going on without being so fearful.
This is going to be a fantastic discussion. We also have 2 what I would call world-class medical experts joining us. First off, I'd like to introduce Dr. Nicole Lamanna. She's a hematologist oncologist at Columbia University. Dr. Lamanna, why hematology? Why CLL specializing? Why?
How many hours do you have? So first of all, I've been doing this a long time. I started at Sloan Kettering, was there for 12 years, and now I've been at Columbia University when we set up a new leukemia service here. So for 10 years, we're at our anniversary as well. I'm also a staunch CLL patient advocate, as well as a CLL physician. As you all know, since I've worked with all of you. But I started doing this because I had an interest in leukemia when I was in my early days of training. I found it a very complex and unique disease. I was very fascinated by the immunologic things that can happen with CLL patients. And so I just found it a very fascinating disease. And so I gravitated to doing sort of training, extra training in leukemia specifically, and then had a mentor who did specifically CLL, and I got turned on and just decided I would continue research in CLL. And so I've also enjoyed building relationships that have lasted a lifetime. And so that has also been a very important aspect of my practice. And so I think that's one of the other things I like about also treating patients with this disease.
Dr. Lamanna, it's always such a joy to see you and to also be with you on these programs. You are such an advocate for all of us, and what a specialist you are. And it's a delight to have you with us tonight. And also we have with us Dr. Spencer Bachow. He's a hematologist oncologist at Boca Raton Regional Hospital. Dr. Bachow, where were you when I lived in Florida? I know the answer. You were in New York with Dr. Lamanna at the time training, but I'm going to ask you the same question. What drew you to becoming a hematologist oncologist and now further specializing in CLL?
Yeah, so yeah, I knew I wanted to do internal medicine, and I knew I wanted to be a subspecialist. And it wasn't really until I did my malignant hematology rotations as a internal medicine resident that I had role models. These were the types of doctors that I always dreamed of, that they looked like, they sounded like, they talked like. This is the type of doctor I want to be. The way they thought about patients was very different than the way the cardiologists or thoracic surgeons thought about patients. And I knew this is the type of doctor I wanted to be. So I got into it from great role models. And the same with CLL. I mean, Dr. Lamanna was a mentor of mine for fellowship, and you could really just feel the excitement she had and everybody else had in this field of CLL, that a lot of the cancer advances that we've seen in CLL are, I mean, they're some of the biggest. The transformation of the treatment of CLL is one of the biggest cancer advances of the 21st century. And then finally, also kind of like what Dr. Lamanna said, it's a very heterogeneous disease where a lot of patients do well over the long term. You could establish long-term relationships with them. And then if you do, some patients are a little sicker and you get a chance to help people during some of the most difficult stages of their lives.
Wow. Thank you, everybody. This is going to be a great program. One of the things that Michele and I constantly hear, constantly see, especially on the internet groups, is the recommendation to get a CLL specialist. It's almost always the first thing that's tossed out to someone new who shows up. Go get a CLL specialist. Now, I'm fortunate. I live in a metro area. Michele's fortunate. She lives in a metro area. Getting access to a CLL specialist, not very difficult for us. We have them around. Not everybody that gets diagnosed with CLL has that access to a CLL specialist, or maybe they do. And that's what we're going to be talking about today. How do you build a strong CLL team when you might not necessarily have one in your hip pocket? Even though I live in a metro area, my first doctor wanted to start a treatment program that was ancient by CLL standards. And I quickly learned that it wasn't right for me. I had to make changes. I had to get a CLL expert on the team. Well, I did just that. And here I am 13, 14 years down the road, doing great because I built a good team. That's what we're going to talk about with this program. Michele, you have another take on it. Yours was not quite straightforward.
No, it wasn't, Jeff. And my story is a whole lot different. And, so I didn't even know what a CLL specialist was. I did know there was such a thing as hematologist oncologists. But, that's just because I knew him personally. Doesn't mean I really knew exactly what all this meant. And I think that's how a lot of us are when we're first diagnosed. So I did say, Dr. Bachow, if only you had been in Florida. I was first diagnosed in South Florida. I was working there. I had like the coup de grace job, the job of my dreams. I was at, the C-level with a corner office in a major international company. My office overlooked Biscayne Bay. And I was diagnosed by someone at a hospital nearby, except they didn't explain anything about CLL. They told me, to come back in 4 months. They had nothing to give me when I asked. But again, this is back in 2012. Things have come a long way since then, thank goodness. I left everything behind. I really didn't have to. I quit my job. I left my condo, moved back north because I was living between Boston and there. And I knew Boston, of course, has a plethora of healthcare. And I started seeing a CLL specialist once I heard about one. And hence, that's how I started building my medical team. But unfortunately, that first experience, there was just no one in South Florida. So I commend you for being there and specializing in CLL, because the area so needs you. So that is my story. And ever since then, I have been a huge proponent of what our program is about. And that is to have a CLL specialist on your team if you don't live near one. You don't have to have one to see all the time. Jeff, when you heard about specialists, did you get to one right away, or did you take your time in seeing one?
For me, it was right away. I did not feel comfortable with the advice that I was getting. And I leaned on a family member who worked at a large research facility in Houston. And they got me hooked up. But what we've been doing, what you and I have been doing over the past years, is encouraging people to get in touch with a CLL specialist no matter where they are. That's actually something that Lisa was encouraged to do. So I want to toss this to Dr. Lamanna. How do you work with those local hematologist oncologists? How does this whole concept of having a CLL expert quarterback, how does it actually work in real life?
Yeah, I mean, what you guys, obviously you both have been blessed by being in cities that have major academic centers that have CLL specialists as part of them. But there's no doubt that depending upon where you live in the country, that I mean, let's be honest, not every place, CLL is not a common disease in the sense that it's not like breast cancer or colon cancer. CLL is relatively small in that sense when we compare them to solid tumor cancers. And so, most oncologists might see a little bit of this and a little bit of that, and that's fair. And so, although a lot of us would love for every CLL folks to come and see me in New York, we know that's not feasible or possible. And so oftentimes, folks will come for an opinion or to discuss their disease, or at a crux where they might need treatment. And then I will sort of communicate, and whether that's first via phone or via email or message, and start a relationship with their local person to sort of help guide them, particularly if this is not a disease they typically will treat. And so because there are so many drugs, as Dr. Bachow alluded to, there's such an explosion of treatment options that sometimes navigating these treatments with patients, and also depending upon other factors about them and maybe their other medical problems or their disease, sort of picking and choosing between different drugs can seem a little daunting. And so oftentimes, I'll be the go-to to try to communicate with their local physician to see if I can help them and guide them, and sort of be a linkage between the patient and their local physician to try to help navigate their way. And sometimes it's extremely easy because their physicians are very willing to have that sort of extra specialist sort of help them in an area that they're less familiar with. Sometimes it doesn't go as quite smooth as I'd like. And oftentimes, if I think something's a red flag, I mean, my patients know me, I will speak honestly about that, because then I need them to find somebody that I think is going to be in their best interest. This isn't about egos. I know many patients actually feel uncomfortable about having a team because they don't want to upset their local physician. Well, remember, this is all for you. This isn't for me. This isn't for your local physician. This is really about you getting the best care that you need for your CLL. And so I think if you're uncomfortable talking about that with your physician, that can be a problem, right? So you want to be able to communicate with your physician and the physician team about your needs and any issues that arise. And you're going to build a long-term relationship. So you want to find a physician that you can trust locally, that you can work with throughout the years, and that hopefully if advice is needed from somebody like myself, that they're willing to take it, because likelihood is I probably see more CLL patients than they do. And so so I think that most of the time it works well, but occasionally there may be some issues that need a little bit of hand holding until it smoothens out over time, so that you can also include the specialist, particularly at certain crutches that might come along on your CLL journey.
Dr. Bachow, what can you add to that?
Yeah, just echoing what Dr. Lamanna said, the CLL specialist is very important. I mean, there's a huge landscape, that's the right term, of all kinds of different treatment options that we didn't have several years ago, and knowing when to use them and how to use them and how to safely use them, that can be tough for anybody. So employing the CLL specialist is very, very, very helpful as a local CLL doctor and a local hematologist, oncologist. But also, a lot of times we don't have access to certain clinical trials that our patients may be candidates or may be interested in. And I think that is a huge plus you can get when you have your patient meet with the CLL specialist. The local doctor is still important because, local means local. Things happen, complications happen, hospitalizations sometimes occur. And if you don't live near your CLL specialist, having somebody there that knows your care is very important. Additionally, a lot of the CLL treatments these days, some of them can be very labor intensive and require very frequent follow-up. So, unless you're planning on moving to where your CLL specialist is, logistically very difficult and may not be quite as safe to do it from afar. Having a local person that you can trust, that your CLL specialist trusts, that you can work together as a team, I think is so important.
Thank you, doctor. Now, Lisa, I met about 4 years ago. We've been buddies virtually, but she lives near where I used to live in Florida. You learned a lot. You were able to be your best own advocate, which is so important. And I've always noted that. Could you share a bit about when you were diagnosed and your experience and how you've ended up like this, like so educated and advocating?
Like I had mentioned before, I was diagnosed at a routine physical. I was with my primary care doctor. She redid the blood work thinking it was a machine glitch, and it wasn't. And so I was immediately sent to this wonderful local doctor here at the time, and I adored him. He gave me some information, but he wasn't a CLL specialist by any means, and he was very open to me going to other places. And it was really the resources online, these support groups that I found, Jeff, that I got directed just by speaking to people who had already lived this experience. And here it was, I used to watch a lot of videos online, and this is where the story turns. Dr. Lamanna is very generous of her time, and she sits on a lot of panels. And I would hear her on these panels. And on some of them, she was sitting right next to my other specialist. He was getting older and was going to retire too. I knew that was coming. And I just was drawn to her. I would listen to her. I loved how she spoke, how she relayed information. I loved her personality. And I said to my husband, I was like, I really like her. I want to go have drinks with her. That's how I felt watching the videos. So it was just a small world. I had a visit with my local doctor at the time. And I mentioned Dr. Lamanna to him. And he literally looked at me and said, I don't know why I didn't think of this before. And he goes, I think they did their residency. They knew each other very well. And he literally in front of me texted her and said, I have a patient and I'm sending her to you. And my daughter was also moving to New York. She was just graduating college. And I think, you have to find what's going to work in your life. And it made sense. I was going to be going to New York for other purposes anyway. So why not have a specialist there? The puzzle pieces came together. And I had this wonderful team. And I felt that my local doctor, he had a better means of communication now. Like my specialist and my local doctor, loved them both, trust them both, and they would communicate well.
Thank you for sharing that with us. And so one of the top questions Jeff and I are asked a lot is, so how do you find that CLL specialist? Just like I asked Lisa, but what does that mean? And how do you find that right one for you? We have here a video coming up from Scott W., who talks about how he found one and his path to getting one.
Hi, Michele. My name is Scott Wagoner, and I'm a news photographer in Cincinnati, Ohio, and I was diagnosed in November of 2019 with leukemia, and then a couple days later, they verified that it was CLL. Well, at first, I didn't know what a specialist was. I was assigned a hematologist at one of the hospitals here in town. And it was kind of a shock to find out that there's this thing called watch and wait, which just didn't make sense to me, as I'm sure it didn't make sense to a lot of other first-time, folks diagnosed. I started doing some research and finding, that there's some controversy, I guess, and some progress being made of whether watch and wait is appropriate or not. And I started questioning my hematologist about it, hematologist oncologist, and he didn't really have any answers for me. So I sought out another hematologist, still didn't know what a specialist was, and was getting sort of the same thing, and saying, well, you've got about 5 years to live. But you're not sick enough to have treatment. So I got frustrated, and by good fortune, my general practice doc said that one of the premier specialists in the world was coming to Cincinnati, where I live, and that he is accepting patients for CLL. And so I signed up and was one of his first patients here in Cincinnati. And within 5 minutes of our first meeting, he said, yes, we can start you on treatment right away. And I can say with, quote, 95% certainty that we can put you in remission and reset your lifespan to pre-diagnosis limits.
Well, that was great. So another question that Jeff and I consistently see on our Facebook CLL support group is, at what point do you need to bring on a CLL specialist onto your medical team? So how do you find a CLL specialist, Dr. Lamanna? And, is there a list of them?
There are lots of lists of CLL specialists in states all across the country. And so that might provide a starting point for some folks, depending upon where you live. As Lisa noted, part of it is, it might be, you might be restricted because you need to see someone in the area that you live because of your circumstances. And so you want to do local. So that's complete. So you have to do what fits for you. There's some people like Lisa who can travel. And so, having the ability to travel to another state to see a specialist. And then ultimately, yes, your personality and a personality of another physician has to jive too. And so not everybody may jive with a particular person. And so that's another layer to add in. Now, when should you see a CLL specialist? I think there's a couple of points that I always bring up. Sometimes, depending upon when someone's initially diagnosed, if you're not finding that you're receiving the information to explain everything so you understand the disease and where you're at, sometimes having that luxury of a first consultation is very helpful if the local physician isn't spending enough time to kind of explain things because you don't need treatment and they're sort of rushing you out the door and saying, you have a good cancer, you don't need to see us, you're great, and so that's not really satisfying to many patients when they're first diagnosed with any cancer. So sometimes that initial consultation is important. Another very important time, which Dr. Bachow brought up, is sometimes when you're told you might need therapy. The question is, do you need therapy? And then what kind of treatment is being recommended, because there are such new agents, and each patient might have a little bit of a different nuance to their disease. And so I think that's another key point in time to see a specialist is when you might be recommended to have therapy and what treatments are being offered. And then, of course, certainly there are clinical trials. I know Jeff alluded to that, or Dr. Bachow alluded to that earlier. And certainly there might be some clinical trial options that could be really important as well. So I think those are two opportunities that might be important. Certainly, any time is a good answer, but I think if you really don't have the ability to do it very frequently, those key time points might be important.
Dr. Bachow, what do you have to add on to that?
Yeah, anytime's a good time. A good time, just like Dr. Lamanna said, is if you're at diagnosis and you don't feel like you're getting all the information that you need to feel comfortable with the diagnosis. But there was one time that you really should. It's when you say, okay, you're going to need treatment. But you could also take it a step further. You don't want to wait too long. Where in some cases for patients with, very high risk disease, their disease can grow exponentially. And it may be tough to get in to see a CLL specialist because they're all so great and they're booked out weeks and weeks and weeks, and they're doing favors all the time, double booking patients to bring them in. So I wouldn't necessarily say also that just when you're told that you need treatment, but you and your doctor should try to talk together. Am I one of these patients that are more likely to need treatment in the future rather than not need treatment? Maybe now's the time to go get more information, hear what trials are out there, hear what the treatment landscape looks like now. So if the time does come, you're not rushing to get into somebody and perhaps need to start something before you can even see the CLL specialist and then have to backtrack a little bit.
That's such an important point, Dr. Bachow. You want to have that established relationship in case it is more of an emergent time. Personally, my CLL relapsed really quickly. And I was looking for a second opinion because I was given so many choices. I mean, that's the beauty of research right now, right? Because we do have so many choices between what's been approved and what's in trial. But I didn't have time to find someone. I mean, I had to start treatment the next week. It was that emergent. And I have to say, thankfully, I had a great relationship and established one with Dr. Lamanna. This brings up that there can be challenges, though, in getting into C1 or workarounds and working with different kinds and different healthcare systems. Lisa, what did you experience here? You were working with different healthcare systems.
So I was encouraged to go to one of the most world-renowned places for leukemia and lymphomas, and I went. And it was great. They were wonderful. I don't have anything bad to say about my experience there, other than it wasn't the right place for me. The first doctor I saw, who was lovely, I ended up getting a letter shortly after my first appointment that she was no longer there and had moved to a different facility in California. So then I was on my second doctor there. So the next time I went, I was meeting a new doctor again. But the biggest problem was my local doctor having frustration. Once I did start treatment, I did my first course of treatment there, and then they sent the protocol home so I could finish here. And he was frustrated with lack of communication. Unfortunately, my local doctor passed away unexpectedly. And so I was left with this situation where now I didn't have my team. But the first time I ever went to Dr. Lamanna, being a research hospital, being, a learning institute, a place with trials, Dr. Bachow happened to be her fellow. So, and me and my husband both, when we met him, we adored him. We thought he was great. He was a Gator. We both went to University of Florida. We knew he was moving back to Florida, getting married, starting his life there. So when I was in this position, we remembered that he was going to be coming back to Florida. And I called Dr. Lamanna and she said, yep, Spence is in Boca Raton. And I was really lucky to have this. And he's just as wonderful. You need to have trust in both your doctors. And to me, the biggest thing is communication. I think having a specialist, nowadays we have telemedicine visits. So if you can't travel as much, it's really important to try to get in the system with a specialist so that when they are needed, if your disease does accelerate, you're already in the system, as we mentioned before. But we can also, I can see Dr. Bachow here, and if we have questions, if there's an unknown, we're unsure, I can see Dr. Lamanna via telemedicine visit through Columbia Health. We can send my lab reports. So I think it's the communication, the ease of appointments, whether you're traveling or doing virtual, and trusting both your doctors, and that your doctors are willing to have a shared patient relationship with each other. And that's what I have been fortunate to find, not once, but twice. And I feel so grateful for that.
I would love to tie two thoughts together, if you'll indulge me for just a moment. You went through a lot in the beginning. You had to deal with different doctors. You had to deal with travel. You had to deal with different levels of comfort. And ultimately, it was your comfort, your ability to mesh well with the doctor, as opposed to being abrasive, that guided your decisions. And I want everybody that's watching this to know that's really, really important. We've got two doctors on this program right now who are enthusiastic, and their personalities are top of the scale. That doesn't always happen with every patient relationship. Like you said, Dr. Lamanna, the goal here is not a short-term relationship. The goal is a long-term relationship. We're getting a ton of questions already, and we have a great question that has come in from Lonnie. Lonnie wants to know, just how do you coordinate between a local oncologist and a CLL specialist at a distance? This can be a lot of heavy lifting. Dr. Lamanna, I'll start with you.
Again, as we said earlier, as long as the CLL specialist and the local physician make communication, there's obviously lots of different ways that they can build a relationship. I mean, certainly phone and messaging and texting are one way, getting records seamlessly. Sometimes those are via email, attachments, faxes. I think as long as the two physicians are willing to communicate, now remember, different physicians may want to communicate in different fashions, but as long as you can make a connection between the two and they figure out which way works best for them, that's fine. Again, if there is, as Lisa noted, if there seems to be a struggle, then obviously something's not working well, and that needs to be addressed, because you want records and things to be done in a decent time frame, especially if it impacts you. But there's many different varieties to establish that communication, given the technology that we have today. So it's not difficult, actually, as Lisa also pointed out, with Zooms and things like that. Technology's gotten better. It's become easier to communicate. And so there are a variety of different ways that two physicians and the patient can do that.
I've got one for you, Dr. Bachow. Sarah asks, how do you keep everyone in the loop when everybody's using different platforms, different medical record systems? I know we'd like to think that everybody's on the same page, but that's not always the case. How do you guide patients? And can you tell us some of your experiences when the platforms don't sync up quite perfectly?
Yeah, of course. I mean, the way, communication can happen is, of course, office notes and consultations should be faxed back and forth. But really, I mean, the best way of communicating, and not just like Dr. Lamanna said, every doctor is different. Best way of communicating is probably more direct. Email, cell phone. Do the two doctors have a prior relationship together? Do they see each other at national meetings? Luckily, the hematology and CLL world is somewhat small, and people do know each other. We know each other quite a bit? But having the two doctors having had a prior relationship, maybe they shared a patient in the past, I think is important. But that doesn't always happen. You do have to recognize that doctors are busy, and what you really should also discuss with your local doctor, your local hematologist, oncologist, also is what changes are, what kind of changes that we're seeing, what kind of changes would we see that would really warrant us reaching out to the CLL specialist sooner rather than later? We're just sending the office note, letting them know the most recent CBC results or physical exam, et cetera, would suffice, or what kind of changes would warrant us to pick up the phone and call them? So there are many different ways to communicate, as long as the local doctor and the CLL specialist feel comfortable communicating in that way. I mean, obviously, I communicate with Dr. Lamanna about patients we share, with texting and email, et cetera, and I do that with a lot of other doctors as well. But I found also that working with other CLL doctors around the country, that not all of them are like that, and that's okay. Some of them, everybody's extremely busy, but some of them are very busy. They're running a lab, or they're traveling all the time, and getting access to them is not always very easy. And sometimes you do have some important questions for them. I've had an experience where I learned that it doesn't matter how much you email, or if you do happen to get their cell phone, I'm just not going to be able to talk to this doctor. But I've learned to build relationships with that doctor's staff, the nurse practitioners, physician's assistants, advanced clinic nurses, and who have direct access to the CLL specialists, and they've been able to convey information. And I feel comfortable with that. And as long as the patient felt comfortable with that, then it turned out to be okay.
Speaking of navigating the relationship, for many of us, it will be unclear how closely two doctors are able to work together, willingly or otherwise, especially if they have a bigger gap in knowledge and approach. With CLL treatment options changing so quickly, how can we ensure that we're working with a local hemonc who is also very interested in new therapies, or at least open to discussing them, instead of those who maybe, shall we say, more set in their ways of how to treat CLL?
to be honest, obviously the relationship that Spencer and I have of obviously is a unique one, right? So that's it's a little unfair. And obviously Spencer is more closer to somebody who's a true academic doc than not. So again, so he has access to clinical trials and things like that. So you're really talking about folks that are more dealing with hematology oncologists who also treat, lung cancer and other things, and, one or two CLL folks. And so there's no doubt that I think that could be more of a challenge, as long as if their willingness to communicate with a CLL specialist is there. If you got a doctor who is a good physician, period, and that's really what it boils down to, is having a good doc that you can communicate with and who takes good and loving care of you, then a CLL person can guide them in terms of the treatment options and help with management of certain toxicities and issues with drugs that they need to look out for while they're treating somebody. So it doesn't need that they necessarily have to be, the local physician has to be somebody exactly like Spencer, who's perfect. They need to have, they can have a very good physician who's willing to talk with somebody who has more experience treating the, CLL than they do, but they're really willing to hear them out. And so, they again, it's a feel out. And so sometimes my first initial calls with a local person will actually serve as I'm actually in a way interviewing. So when a patient that I'll see, I'll be like, I'll call your local doc. I'll get a sense of how they are. And talking to them as somebody who does this all the time, I can get a sense if this is somebody I can work with. If it's somebody, even if they don't know the data, and I'm not expecting them to know the data, but is willing to kind of understand certain things that I'm looking for or what they need to pay attention to, versus somebody who really is irritated by me calling, doesn't want to hear me, doesn't want to hear that I'm a specialist, and let alone a female, because they're somebody who's really stuck in their ways and they don't want to deal with it. That's a red flag to me. And I unfortunately don't mind telling the patient that I have a problem with that. And it's up to them to choose whether they want to stay with that physician or not. That's not my call. But if they don't want to work with me and I'm trying to help the person, then that tells me that there's a problem, right? So I sometimes will use a call as a vetting, particularly if it's somebody I don't know, that I haven't worked with before, just to see if there's somebody that's willing to work with a specialist if the patient needs it. So I don't know if that quite answers your question, but that's the more common. It's not the relationship that Spencer and I have. It's the, somebody that's completely doesn't do this at all and doesn't know anything about this. And that's more routine. And to be fair, I'm sure not every CLL specialist wants to do that either, because that's a lot of extra work. So I don't want to say that all of my colleagues, will be willing to do that. But I do think that most of us who love taking care of CLL patients and want the best for the folks that come and see me, like when people come and see me, I don't stress that they need to stay with me, in other words, especially if they're coming from far away. If I'm answering their questions, if they have future questions, they can email me and online and all this other stuff. So, but I recognize that they can't always make that same connection.
That message of CLL specialist as champion is very, very important for patients to hear. They need to know, patients need to know that they have someone in their corner that's going to work towards best care.
Well, that's what you want to do. I know that doesn't always happen in practice. And so, some of us are more willing to do that than others.
Yeah, somewhat a different vantage point, with CLL, Dr. Lamanna and I have a unique relationship and with regards to CLL, but, from my perspective, being in more of a community setting, where I can't only see CLL patients, but I've been able to develop a reputation and build up my practice where I'm only seeing blood cancers for the most part. But 75%, 80% of my practice has been blood cancers. But that just still doesn't mean like some of the non-CLL things that I don't need help with. So, for instance, multiple myeloma, which I've had to learn over the past, Dr. Lamanna, by the way, I just started my 7th year out of fellowship. I don't know if you can believe that, just the other day. But, I've had to, learn how to reach out to and find out who are big in the multiple myeloma field and what are some of the new things, who can I get good access to run cases by, especially for the patients that have very aggressive managed care plans that can't go for second opinions. I know all about that. I have a lot of those patients that can't go for a second opinion. Who can I run the cases by? So it's that's kind of how my perspective is. What my perspective really is that finding good people that you can reach out to run cases by, not just send patients for a second opinion. Those that can't go and have an established specialist, at least being able to run new situations by them in your current patients, and they can give you advice on them off the cuff. Does that kind of make sense?
Yeah, and that's what we were saying earlier, right? That happens too, right? Where doctors will just call because they know so-and-so treats this cancer, so-and-so treats that cancer, and we have those relationships, and so they'll email or just call us. And so we'll be helping them with their local, and their, you know, and we know that their patients aren't going to be seeing us. We're just trying to help them because they need advice on a particular, you know, on a particular tough case. And so, you know, many of us do that as well.
Thank you, doctors, for those answers, because that is something we all worry about. So our next section is about different opinions between doctors. What do you do if your two doctors disagree or have differing opinions on next steps for you, the patient?
One of the bright faces that we have on the CLL support group on Facebook is a young lady by the name of Christy, and she's got a story that she would like to tell.
Thanks, Jeff. I was diagnosed with CLL in 2017, and that's when I was referred to an oncologist. And from that point, we received the diagnosis, and that's when I started considering seeing a CLL specialist based on things that I had seen online from other CLL patients who said that that made a world of difference in their treatment. My first experience with asking my oncologist at the time about seeing a CLL specialist, he pushed back a little bit. He seemed to think that it would be fine proceeding with just my local primary oncologist. And I was a little bit concerned about that because I feel that any patient, regardless of their disease or their diagnosis, should be able to seek a second opinion. And especially in this case, because CLL is such a potentially serious diagnosis. And based on what I had been reading in CLL patient forums and support groups, that it's vital to seek the opinion of a CLL specialist. So based on the hesitancy of my first oncologist to quote, allow me to see a CLL specialist, I determined that it was probably better that I find an oncologist locally that is a better fit for me and is more open to working with a CLL specialist. And so at that point, I not only found a local oncologist that's actually closer to me, just about 5 minutes away, but I also started seeking out a CLL specialist, and I did find one within about 3 hours. And so that was very helpful. That kind of got me started and feeling a little bit more confident about my diagnosis and that I was going to get good information. My CLL specialist now works very well with my local oncologist. I have some complicating factors with my diagnosis. I also have rheumatoid arthritis, and it can get a little bit tricky managing both of those. And so it was really important for me that my oncologist, my rheumatologist, and my CLL specialist work together to make sure that we are treating both while also not harming one or the other. So I think it's very important to find the right fit for you, and don't feel intimidated or don't feel guilty for switching oncologists, or deciding that you need to find somebody who you trust. Not only do they need to have the knowledge to treat your disease, but you also have to be able to trust them. And for me, that's really important.
Well, that was great. The questions keep pouring in. This one is from Laura F. What do you do when you get two completely different recommendations from two CLL specialists? Dr. Bachow, what happens if your doctors have varying opinions about next steps or approach in care? How can patients and caregivers understand the right way to go? And I know this is similar to the last, but it has a little bit of a different nuance.
Yeah, just know that if you're going to have, more than one CLL specialist, and some people get multiple opinions or have multiple people weighing in, there is a good chance at some point that there's going to be a difference in opinion on how you're treated. And that's not necessarily a bad thing. The treatment for CLL has become very nuanced, and sometimes there's more than one right answer. But if you put yourself in the patient's shoes, it can be very frustrating and anxiety provoking. Speaking, really kind of speak to each doctor and say, this, be frank with them. I've seen other doctors and they're recommending this. Why would you not recommend that? And you're recommending this instead. But something else you can do is, if you do develop what I call analysis paralysis, if you have so many different opinions and you're not sure what to do with them, you could use your local doctor to help kind of bridge them all together and kind of weigh the pros and cons of each one to help yourself make an informed decision. But it's a tough situation, but it's also a fortunate situation that if you have the ability to have multiple opinions from multiple CLL doctors, but just know that it can be very frustrating, but it can be managed.
And local doctors generally see you more, to your point, so they might know you better. Dr. Lamanna?
No, I mean, it is very true. I mean, there are issues that there are true circumstances where there's more than one drug that can be totally applied to a particular individual, which is a good thing, meaning that they have a lot of also looking at other things like side effects of the therapy, social circumstances, perhaps your ability to go to and from the clinic. Perhaps one therapy might require a hospitalization or more frequent monitoring, and maybe that doesn't work with your lifestyle right now. So I think there's more than one thing that might go also into choosing an agent. If there's more than one that's being offered, that will be more personal, perhaps not necessarily all due to your specifics about your disease. But there's no doubt that, certainly you can get another opinion, but that sometimes that can be a little bit limiting too, because then it becomes a little bit difficult, as Dr. Bachow noted. It can be challenging sometimes when you're getting 5 different opinions, then what do you choose? And you're the one who's faced with that. So that's a little challenging. Usually it's not that many differences of opinion, but it does occasionally happen. And then sitting down and talking about the different options with somebody who will be more than willing to go through all those options, I think is important, that you can kind of level out all the playing field and see where the differences really are. And that'll help guide to you choose something that works for you.
Thank you, doctors, and thank you, Lisa. We have time for another patient-submitted question. There were multiple questions related to this. This one was asked by Barbara, care partner to her husband, who's had CLL for more than a dozen years. She asks, we are members of a closed healthcare system and are assigned an oncologist. Who needs to be on the CLL team? How do we get them on that team?
You might be able to get a free consultation through some of the panels. CLL Society offers them, that if you're really strapped where you're not able to go for a second opinion somewhere due to insurance limitations, there are different ways through different patient advocacy groups to have access to CLL specialists like myself, to go over your case, for free. So there are different ways to do that. And then sort of, again, many of us are also, we also do take calls from from local physicians without having seen a patient, because of our relationships with physicians across the country, and are willing to talk to them and sort of help advise the physician about their patient, that's having issues. So that, that's done as well.
Thank you, Dr. Lamanna. There are programs to help access a specialist, as Dr. Lamanna was saying. And one that a lot of patients we know have been using is the CLL Society Second Opinion Program. It's called Expert Access. And it's an innovative program offering a free consultation to patients, involving them with an expert opinion to share with their local treatment team. So we urge any patient to consider using this service when they are unsure of their disease status or their treatment plan. And I know, Dr. Lamanna, you do a lot with them. So thank you for that.
So Dr. Bachow, I'm going to ask you first, and then Dr. Lamanna, you're up after him. What kind of guidance can you give patients and their caregivers as far as living that great life?
I agree. You should definitely live your life to the fullest. Staying in close touch with your family. you're still thinking about your CLL diagnosis, but if you're working, continue to work. If you're still able to, continuing your usual activities of daily living.
I don't have much to add except, I've always taught people that this is a chronic disease. And so like many other medical problems that people live with on a daily basis, diabetes, heart disease, hypertension, you live with other problems and you take medications on, some people take medications every day for some of their other medical problems. And so, I think that you really truly need to say this is a chronic medical condition and I'm living with this, like perhaps my other medical problems, and you move on. Doesn't mean again that this isn't an important part of your life, but you need to live your life. And this is a chronic condition that you can live with and that we can manage.
We honestly hope that each of you has taken away useful tips from this little program that we put on and some clarity and guidance on how to build a great CLL team and how to work with different physicians on your team. It makes a big impact. I'm going to toss this to Lisa. Tell us about that impact.
So just like you were saying, I mean, live your life. You've got to, do things that bring you joy, that relieve your stress levels, and then just be confident in the team you create once you find it. And that can be a journey. I'm, lucky I am able to travel to New York, but I'm also lucky that I have Dr. Bachow here, who, I can honestly say, I think I'll be seeing more of Dr. Bachow and not necessarily as much as of Dr. Lamanna because of the ease, because of my trust level in him and knowing that he's also well on his way to becoming a CLL specialist, and how lucky am I? But I love traveling to New York, and I'll check in, and I know she's beaming her mentee, but live your life, enjoy, find doctors you trust in yourself, advocate for yourself, whether it be insurance, your treatment, whatever comes up in our healthcare. And just do the best you can.
So I'm going to tease out just a few more nuggets from you, if you'll let me. We're talking about living a great life, living your best life. Tell us what you've been doing for the past 6 months.
Oh, I had 2 children get engaged 4 weeks apart. So I've been planning weddings. And in the midst of all that, we were building our dream home. So we just had wedding 1, we moved into our dream home, and now I'm well into planning bridal shower 2, wedding 2, and just enjoying all of it. And what I really find amazing about it is that 11 years ago, and I might get choked up, I wasn't sure I'd be able to do these things. I didn't know I'd be here. And how lucky am I that I am? And hopefully in the next few years, when we have another panel, I'll be able to say I'm a grandma. So
outstanding. I love it. That is the stuff that I love to hear, that people aren't just saying words. They're not just parroting things. They're doing that. They're having those moments. So neither of my daughters have managed to get married yet, and grandchildren are not part of the program, but I'm very confident that they will be at some point, because we've got great doctors to work with. We've got the hope for a cure for some of us. We've got great treatment programs. We can do this. I'm going to turn it over to Stephanie.
Wow, thank you to all of you for participating tonight. It was really just amazing to hear what everybody had to say. Doctors Lamanna and Bachow, thank you so much for your time and your dedication to patients and their families. Lisa, just hearing about all that you've been able to do, really appreciate you sharing your story. And of course, Michele and Jeff, always a pleasure to work with you and excited about more collaborations. We are going to send a recording of this program in a follow-up email. So in that email, we'll also list that CLL Society Expert Access Program link, where you can get that free access to a second opinion with a CLL expert. What an amazing resource. And any questions that we didn't get to tonight, they are important to us. So we're gonna try to get some of these answered, and we'll have those answers in what we call the conversation continues, and that will also be pushed out in an email. So When you get the chance, don't forget to sign up to be added to our newsletter list so that you don't miss any of the content and the latest in these programs. And lastly, remember, as soon as you exit, a survey link will pop up, and we really, really count on hearing back from you because we want to know that we did a good job for you, and also want to understand, what do you want to talk about next? What do you want to hear about next? And this will automatically enter you into a raffle for a couple of our $50 Amazon gift cards. So wishing you all the very best, and really hope to see you at our next program and discussion. Thank you.